All right, so for my passion project, I wanted to look into CT scans, which is computed tomography, and just quick basics of the CT scan. They're primarily known for medical use, used to create 3D images of internal structures, but CT scans can be used for geology or excavation sites, a lot of different applications, but the most common, what we think of when we think of CT scans, is for medical use. And before we go into it, there is something that is important to know. It's the concept of attenuation, which is the reduction of intensity of X-rays when they pass through tissues of the body, meaning when it goes through bones, the intensity may decrease as opposed to when it passes through fat tissue. And why this is important for CT scans, as I just said, as hundreds of X-rays are passing through the body, because that's how CT scans work. They go through the body and then land to a detector on the other side, and then the computer is able to calculate and create an image based on the attenuation map. So how CT scan actually collects its data, if you've ever had one done, you lay on a table that goes through a giant tube, essentially, where hundreds of X-rays are taken that pass through the patient, and this tube internally rotates around them, collecting this attenuation data from various angles to get as comprehensive of a picture as possible. And each measurement is essentially a line integral of attenuation coefficients along that path, which basically just means that the measurement is just looking at the intensity levels of the X-rays, and then it's able to eventually calculate based off of those intensity differences. So how it actually creates the image is by solving the inverse radon transform problem using very complex algorithms and back projections, which each calculation that it does creates a 2D slice, and then once it's able to actually stack multiple slices on top of each other, that's where we're able to get the 3D image that we can actually visualize on a computer screen and allows doctors to take a look at it. So a little analogy, because I know it can be a little bit confusing. If we shine a flashlight at an object in the dark and we know what this object is, we can kind of predict what the shadow will look like once that flashlight is turned on. However, the inverse problem that the computer has to calculate for a CT scan is basically analogous to if we know what the shadow looks like, how do we figure out what the object is? Like if you shine a light on something and you know that the shadow is circular, how do you actually know what that object is? And that's what the computer is essentially doing, is taking all that information that it got and then backtracking to figure out what's actually going on internally in your body. Now, the attenuation map essentially tells us about the shadow, like I just said, and the computer is able to create a visual based on all of the information that's gathered and able to deduce backwards what's going on inside your body. Now, this is an example of what a CT scan might be used for the appendix on the left and then appendicitis on the right, which major reason why I wanted to do CT scans for my project is because right before this class started, actually in July, August, I got appendicitis, and so this isn't me, but this is an example of, on the left side, a normal appendix, and on the right side, you can see all the different things that are going on inside your body, which researching this stuff actually made me very cognizant of, it wasn't just my appendix that kind of got inflamed. There are a bunch of things going on in the surrounding area. And so obviously they look very different. All you really need to know is that, the appendicitis, the inflammation of your appendix, which is attached to your large intestine, causes so many issues, and the CT scan is able to pick up all of this stuff. And then obviously a trained radiologist would actually be able to read this pretty detailed, but it's very very interesting to see all this in person and kind of get a feel for what was going on during that time. Now, one kind of downside of CT scans, as pretty much anyone could probably recognize, is radiation poisoning, potential for radiation poisoning. Obviously, doctors are not going to just throw you into a CT scan for no reason. It's important to recognize, benefits outweighing the risk for this or any other scan for that matter. And so just something to be aware of for doctors and health professionals alike. And so, kind of in summary, CT scans rely on the interaction of X-ray photons with matter, attenuation, rotation, geometry, and then are able to use computers to reconstruct and produce a very detailed internal image.